It's the band.
And now, another exciting episode of As the River Churns.
Well, good afternoon, everyone. Happy Monday afternoon.
Yes. Woohoo.
Yay! And we have a special guest today,
Yes.
Lisa.
First time guest.
Before we introduce her, though, we need to help you turn
Yes.
over our hourglass.
Okay, so Tiff, we're going to go forward with it.
Are you ready? Go. Oh, very good.
Perfect.
Okay, so for you residents that have been here for a while, you might recognize who's sitting in between Lisa and I. This is Tiffany Robertson, and she was our healthcare administrator here for a long time. Even prior to that, she was at the Presbyterian Home of High Point.
Yes,
she
we worked together.
She was the interim executive.
Yes.
And now your title is even worse now at the corporate office because it's Director of Informatics, right?
Informatics.
Informatics, and what's the rest of it?
Health services.
Health services, yeah. So it's just too many words, Tiff. I don't know how.
It is.
You know, maybe it could be like an abbreviation or an acronym. You know, Director of IM or something like that. You know, something that you could.
Better than BM.
Definitely.
Now that's a true statement, Tiffany. That is a true statement. So.
I was told to be funny. So.
Well, that's good.
You're doing good.
One
down.
We're used to that because whenever we have Ken, our chaplain, on the show,
we never know.
It gets a little funny then, for sure.
Yes.
So, well, Tiffany, you won't know this, but we typically start our show with a trivia question so that we put out there to our residents. And it's fun because we get to see Michelle run in and out of the multi-purpose room. That's always my favorite part, is watch her running across the room.
And we have one line that you can call in, so she stays pretty busy.
Yeah, she does.
So, okay.
So, what's our trivia question today?
Trivia question today is from Francis Smith, and the prize will be a river landing polo. Give me a second here. Brian's going to zoom in on it. It is beautiful.
Oh, that's pretty.
And it is a unisex one, so male or female.
Okay.
And this one is a size large, but we do have a medium or an extra large. So we could do medium, large, or extra large, the choice. So if you are the winner, go ahead and tell us your size. And they are all the blue color, but very attractive.
Oh,
River landing
yeah.
blue.
That's my kind of shirt.
Isn't that nice? I think it was yours.
Oh. Oh, well, now nobody's going to call in if they know that.
Okay, it wasn't Tom's. It wasn't.
These are brand new shirts,
These are
Lisa.
brand new. Yes.
Okay, let's make sure we say
So
that.
I think that's a great prize today.
Yeah, it's a great prize.
Okay.
Unless you're small.
Unless you're small, then we don't have one for you.
Yeah.
But medium would probably work.
Medium be good.
That'd be my guess.
Yeah, okay.
Okay. So the question is, when Cameron Morrison was inaugurated governor of North Carolina in 1921, who performed the traditional duties of the First Lady since he was a widower?
Oh.
This is a hard one.
Well, yeah.
I think Francis Smith might be winning this polo.
He might.
So when Cameron Morrison was inaugurated governor of North Carolina in 1921, who performed the traditional duties of the First Lady since he was a widower?
Now, Tiff, you were around then, so you have the answer at this point?
This is how the show goes.
Yeah. I don't really remember that far back.
It was a while ago. Yep.
Well, you were just a baby. How could I forget?
I mean, I remember when his wife died, but I don't really remember about that whole First Lady thing.
Yeah.
All right, so what
Okay.
number do they call if they have
So the line
answers?
is open. 336-389-4103. We tried to give you a little more time there because this is a hard one.
This is.
You all are going to have to Google
Oh,
this one.
she's going out of the room. She's going out of the room.
389-4103. That person might not be right, though, so I'd still call in.
Yeah.
She likes to run back and forth. That's what she told
Are you
us.
suggesting that residents should call and give a wrong answer just to have her run back and forth? Lisa, that's not very nice.
That's not nice.
No, that wouldn't be very nice. to
Okay.
do, so. Okay, well, let's see. Hopefully we'll get a winner out of this one.
Yes.
So we'll see how that goes. We didn't mention anything about the photo. That was...
We did. It was Batman.
Was that who that was?
It was Batman post-quarantine. He had some snacks.
I think Batman's been quarantining for a long time.
think we all are kind of feeling the
Yes.
quarantine thing.
Yeah. Well, actually, when I saw it,
Special
I
snacks.
said, where'd they get that picture of me, you know? So, anyway.
Oh,
All right. Well, let's update you on coronavirus. Again, we get all of our information from the North Carolina Department of Health and Human Services. And, so the last report we gave was on Friday, so it's been 3 days since then. And we have seen completed cases rise to 520,000 for the state so far.
Wow.
That's almost 38,000 cases more, tests more than what we had on Friday. So, we're still averaging well over 10,000 tests a day, if you want to look at it that way. And then confirmed positive cases, we went up by 3,229 cases since Friday. So we're at 36,484. So if you do the math and you take the 3,229 cases that have been positive since Friday versus the number of tests, which are about 38,000, it comes out to about 8.5%. And that's a little higher than what we've been seeing as a trend over the last several weeks. But when you add it all back in and look at it from a total standpoint, we're at 36,484 confirmed cases, 520,000 tests. It comes out to about 7%, which, we were at 8% for a while there, and then we dropped down to 7 and a little bit below 7, back up to 7. So we kind of just seem to be hovering around that mark. Unfortunately, we did hit a milestone this weekend with the deaths. We have gone over 1,000 for the state. We are at 1,006 as of today. That is 40 more than what we were on Friday. And the number of hospitalized went up as well by 22 over where we were Friday. So we're at 739 as of today. And we saw that too. Before we got into phase 2, we were seeing, that 550 to 650 kind of range for hospitalizations. And really, since we've gone into phase 2, we're seeing more of that 675 to 750 range has been more of where we've been seeing hospitalizations. And then going down into the actual counties themselves, Mecklenburg is still leading the way. They have 5,682 cases there. That's 625 more since Friday. That's a pretty big jump. Let's see. The next would be Wake County at 2,300, and that's 233 more than Friday. Durham is next at 2,180, and that's 303 more than Friday. And then it's Forsyth, which we saw this last couple weeks happen, and Forsyth was way behind Guilford for a while there, and then all of a sudden it caught up and passed Guilford. So 156 new ones since Friday in Forsyth. They're at 1,816. And Guilford had 157 since Friday. And Guilford and Forsyth were just about right on the money there. And Guilford has 1,665 positive cases so far. So we're seeing a little bit of an uptick, I think, in positive cases. Part of that's probably because they're doing more tests. But, you kind of wonder a little bit, is phase 2 really having some impact on this? Because, there are a lot more people. And,
sure.
I've seen a little bit of it, not a lot, but I see, and I'm not talking about our residents per se, but, I've been in the Lowe's once, and in Lowe's, there was most of the people in Lowe's were not wearing masks, and I was really disappointed about that it's people just aren't, I think people just are taking this pretty casually, that now that we're in phase 2, all of a sudden we don't have to wear masks, we don't have to social distance, and that's a problem, I think. And then the second half of this is, we always report on the North Carolina Department of Health and Human Services gives us the number of cases that are in nursing homes and residential care facilities, and that number as of today is 4,534, which is 12.4%. And I was telling Lisa this today, that percentage has really dropped over the last 6 weeks, because for a while now we were at 15%. It was steady 15%. 15% of all the positive cases were coming from nursing homes and residential care facilities. And, it's dropped. We're at 12.4%. So I take that as a good sign for us. Mm-hmm. Maybe it's another indication of what's happening out there with phase 2. I don't know. I'm not trying to interpret that. I'm just trying to speculate. And then the deaths have just been steady 60%, and they're still at 60%. 60% of the deaths in the state have come from nursing homes and retirement residential care facilities. And then the number, we talk about the outbreaks, and we talk about how many nursing homes and residential care facilities have had outbreaks, and we add that number together. So if you add that number together, we're at 145, and we were at 145 on Friday. So the facilities may have changed because it's all based upon that last 28 days, but the number has stayed the same. So that's kind of the stats from North Carolina Department of Health and Human Services. But Tiff, maybe it's kind of appropriate. I think it's very appropriate that you're here today because, we put out an announcement yesterday on Care Merge, and I think it's going out in boxes today that, unfortunately we have had our second staff member test positive for COVID-19. I think the good news about this particular situation is that this person had a heads up that they might be getting it because of a spouse that had tested positive. This particular person also had just been tested by us because they were working with the first person that had gotten it, and they had tested negative right before this, and so now they have been tested, and they haven't been working here at the facility for a week at this point. So I thought it was very encouraging that when we talked to the Guilford County Health Department, they pretty much said, you all don't need to test. We know where it came from. That's the important thing. And the employee was very good, had because of the education we've been doing with our staff, they knew that, any kind of signs or symptoms, they stayed away, and then they got tested and told us the news. So I think we did very well. We dodged another bullet, I guess, if you want to look at it that way with this one. So both of our staff members so far have been healthcare dining folks at this point. And, Tiff, we've been kind of preparing our residents a little bit for a little bit of a philosophy change. I think early on we really were pushing to try and keep it out of here, help flatten that curve. And I think we did a great job of that, keeping it out of here. But we know with 375 staff members and now residents going out into the public that, the idea of actually just keeping the coronavirus out of here is probably next to impossible. And we're starting to see that not just here, but our sister communities and everything else. And we can talk about that in a few minutes. But, that's just one reason why I'm really happy you're going to be on the show today, because I think we can talk a little bit about some of that discussion. So we'll get back to that. But I think it's important for residents to know that, we are, the Guilford County Health Department was convinced that it was contained to just this one employee. That's why they didn't suggest we do any testing. Our medical director was in agreement with that, and so that's kind of where we are. So, and both, I should mention, I had asked about this. The employee who first got the coronavirus here is doing very well.
Good.
And has been starting testing because they feel like they're over the COVID-19, and so I think we require them to have two negative tests within a certain period of time before they can come back on campus. And so I think they've had the first negative test and they're getting the second one. Okay. So I think that's really good. And then the one that hasn't now, so far, symptoms have been very, very minor, which we've been very happy to hear about that too. So obviously we don't want anybody to have to suffer with that. Okay. Lisa, what else do we got?
Okay, just want to go over again that there is still no visitors on campus.
Right.
I think it gets a little fuzzy sometimes. Going into phase 2, I can leave here. Does that mean people can come in here? So just as a reminder, there still is no visitors coming on campus. Hopefully when we get into phase 3, that might change a little bit, but we just don't know.
Well, and we can ask Tiffany, since we got our expert here with us. Maybe she has some thoughts on whether or not that'll change or not with that. So we'll pick her brain a little bit on that.
Yeah, so just as a reminder to that. And also, we have a handful of homes that right now, they can't watch our show, Tom. I mean, it's kind of devastating.
Oh, wow.
You know what the thing is? They're not
terrible.
calling us to let us know, though, if that's what it is. I think they're very happy that they can't.
They're not, but some of them, a handful did call and say they're missing our show.
Yeah.
So there's a few people out there that watch us. But if you're one of those people and you have not reported that you can't get 1390, call John Bryant to make sure we get you added to the list. It's a bigger issue than what Spectrum thought. They're still trying to pinpoint why it's causing this issue, since it's not just in one area here, except we do know it's only outside folks. So it's
Right.
people that live out of the main building here. So it's in our neighborhoods. So just give John a call if you have not added your name to that list of not being able to receive 1390.
So, Lisa, if they're not watching the show, how are they going to be able to let us know?
They just have to turn on 1390.
They have to be psychic. So if you're psychic and
Tell
you're,
your friends.
They
you're
just
watching
got
the
to
show-
turn it. Just got to turn it on.
That's like taking attendance and saying, raise your hand if you're not here.
I love it.
Okay, so if you are a friend
like
of
the
somebody
friend.
who doesn't
I like
have
the friend
1390,
idea.
and
Yes.
you know that, please encourage them to call us and let
Yes,
us know, right?
absolutely. I love
Okay.
the friend. Phone a friend.
Phone a friend, yeah.
Yes,
Yeah.
phone a friend.
Buddy
if
system.
everybody phones somebody,
Yes. And like you said, I
it's
think
getting complicated.
the interesting thing to me about this is it's not one little local area. I mean,
No.
it's like
No.
one
It's hit
resident
or
over
miss.
here, there's another resident over here,
Right.
and it's
Right.
in different villages. It's all over the
Absolutely.
place. So
Yes, yes,
it's weird.
it is.
We don't know
I
why
think
some get it and some don't.
we don't know. I think there's 11 people right now that aren't getting
Yeah.
us on the TV.
Right.
But
So we've taken it up to a higher
we
chain
have,
of command.
we
on
have.
the
We
spectrum
bumped it
ladder
up.
here at
So,
this point.
so hopefully they'll be able to figure out what it is.
Okay.
Okay, question time. Do I need to wear my mask when I am in the hallways or common areas at River Landing? Yes.
Yes. Yes. Yes.
So you're wearing the mask when you're in a hallway here, you're in the living room, a common living room, the library, and also all the dining venues. So that is still in effect, that you wear your mask when you're out of your home. Now when you're outside walking, you don't really have to wear your mask then, unless you come up to somebody, then you want to grab your mask out of your pocket.
Right.
Go ahead and put it on.
Right.
But just try to maintain your 6-foot distance outside. That way you wouldn't have to pull out the mask. But always have it on you when you come here into the main building.
Yeah. Please do.
Yep. And the
Okay.
clubhouse.
Yeah. Any of our common spaces.
Right, right.
So.
Okay. If I have to go to the hospital and go in an ambulance, how can I protect myself? I think we talked about this the other day, Tiff, didn't we? So there's some good tips. If you're going out to the hospital, hopefully you don't have to, but if you do have to for some reason, put your mask on even before you go. Go ahead or ask the ambulance people. I would really like a mask. Anything to give yourself that barrier as you're entering into a hospital. I mean, none of us know what's in that hospital that night or that afternoon. So anything to try to protect yourself, just keep that in mind. And I know it might be hard to think of that when you're not feeling good and whatever else might be going on, but if you could think about that, put a mask on, that would give you a little more protection. Any other tips, Tiff, that you could think of?
No, mask is
Okay.
most important.
That's, okay. So that was a good question. Thank you for asking that. Next one, can I meet with my family when they are dropping off my groceries at the front desk? Unfortunately, no, not during this phase.
Right.
We're still asking that all family members, one central drop-off. It used to be the clubhouse. Now it's our front desk area. We have people stationed up there to receive the items, and then we will deliver them to you, or we'll give you a call that they're here. But we are asking no contact between that family member at this point on our campus here. Okay, let's see. We have one more question. River Landing has focused so much on staff posing a risk to us residents, but now residents are going out and are just as much risk to each other. So my question is, if a resident or one of their family members gets the virus, should they or do they need to report it to River Landing? That's a great question.
It's a very good question.
So,
And if you as a resident have come down with COVID-19 or the symptoms of, you absolutely need to let us know that.
right.
Absolutely need to let us know that.
And any family and any
Right.
close friends that you've
Absolutely.
been exposed to.
Yeah.
Yep.
Yeah. I mean, that's to me is just standard protocol for helping to protect the rest of the residents
Right,
and
right.
the staff that are here. And, if we don't know, we can't help you protect
Right.
other people. So
Right.
even if it's just symptoms, even if you
Right.
don't know that you have it.
And don't be afraid to tell us. I know sometimes there's
Yeah.
some fear out there, but
No.
don't be afraid of that. We'd rather be able to address it and protect other people. And if we don't know, you could be out there spreading something that we didn't even know to stop.
Yeah.
So,
Yeah, so, well, those are good questions. So
very good. Yep.
So, Tiff, well, we're excited about having you here.
Thanks
And-
for having me.
Yeah, and poor Tiffany, we called her at 2:45 today, right, Tiff? Isn't that what we said?
It's
Hey, can you be
close.
on our 3 o'clock? We weren't that bad to you, were we? We did call you this
No.
morning, I think. But
Yeah.
we found out you were in the office, like, we need you on the show today. Come on over. So, and, it's always fun to be with you. I mean, I know we're in interesting times now with the pandemic and all, and I know you've got a lot on your plate, but it's fun to have you come back here, even just to visit a little bit, because it's a little bit old times.
Yep.
We've worked together a long time. 3 of us worked together a long time, so
yeah.
it's fun to be able to kind of have you come back and see you again. And so as a matter of fact, a lot of our management services office folks have been working from their homes, right?
Some have, yeah.
Yeah. So, and I know you've had a chance a little bit, I think, to work from home. I don't know if you're working as
Not
much
too
as everybody
much.
else,
Yeah.
but
You're
some of
just
the other
working
ones.
7 days a week, though. I mean, that's
Yeah.
that's
You
that's
are
what
correct,
changed.
Tom.
Yeah.
You are correct.
Yeah.
After
thought
5
that's-
o'clock and on weekends, I am working
Yeah.
from home.
Correct.
Yeah. So you all just need to know Tiffany's role, what's been now absorbed in her role. I don't think she ever expected this. But what's been absorbed in her role is she is kind of our go-to person whenever we have any kind of potential COVID-19 situations or questions. Tiffany is our go-to person at our corporate office, and she has been extremely helpful to us
Yes.
over the last 3 months as we've been working through this. And, if nothing else, just as we're bouncing ideas about what we wanted to do here to help protect the residents, you are a wealth of information and giving us great suggestions. So thank you for helping us out with that.
My pleasure.
And it's not just us; it's the other communities
That's
doing
right.
the same.
Yeah.
So
Yeah.
Yeah.
you're kept busy. We know.
Yes. Yeah. A lot of questions.
Yes.
That's okay. Yeah, I never knew I was going to be the COVID or pandemic response and planning coordinator for the organization. It's a lot of fun.
Yeah, I'm sure if you had it to do over again, you wouldn't. I'm sure.
I'd
So.
find somebody to delegate it to for sure.
You just weren't quick enough.
Nah, sure wasn't.
Tiff, it might be helpful for residents to know a little bit, other than the COVID-19, when you weren't doing COVID-19 99% of the time, what was kind of your role? What kind of things did you do?
Okay.
I know you work really closely with our healthcare administrators and our directors of nursing at all 5 of our communities. So why don't you talk a little bit about that?
Sure. Well, as the Director of Health Services, my primary responsibility is to make sure that we have the most up-to-date information on new regs, and we are applying those new regulations appropriately. Getting ready for the surveys that we have in our nursing centers, and sometimes in assisted living as well. So that's my primary role most of the time.
Yeah.
And we've had a lot, our regulations have completely had a rehaul in the past 3 years. And so that's kept us all very busy in our healthcare centers, trying to make sure that we are crossing the T's exactly where they want us to and dotting the I's exactly where they want us to. I mean, these regs are pretty specific about a lot of things. It might surprise some folks. So I was already in a position to be checking governmental agencies for regulations. So that's another reason why I stepped into the role as the COVID or pandemic coordinator, because that was already part of what I did. Now, it's never changed with the frequency that it does now.
Right.
The CDC and the Centers for Medicare Services, or CMS, issue new guidance sometimes daily. So that's a big part of what I do, is checking those websites, and this is what we're doing today, folks. And I've also had the opportunity to have a lot of training from not only the CDC and CMS, but Johns Hopkins and Vanderbilt on what the latest findings are with the COVID, what the latest trends are. Some of the places that faced this early on the West Coast, we were able to hear them discuss about what they would have done differently. So we tried to learn from just the real tough time they had out there. Yeah. So, yeah, that's kind of what. I do some stuff called informatics, but nobody ever wants to hear about that.
I assume that has some things to do with information gathering,
yeah,
and trending.
That's your graphs and your spreadsheet.
Yeah, it's really looking at data. Yeah. And what does the data that CMS or Centers for Medicare Services, what is the data that they have about us? Is it portraying an accurate picture? If not, how do we change that to be more accurate? How do we give them more accurate data? So yeah, my spare time, I do data management.
You know, Tiff, one of the things I was talking about Friday was that Guilford, I'm sorry, we had who was it that came out? The HSR, I guess, that came out and sent a surveyor here last week. And, you know, obviously you know this because you've been working with them, and you're a large part of why we're so successful. But, you know, Kat Banks and Tony Chapman and our whole healthcare team they've done an incredible job over there. And it was neat to hear the surveyor say, I wish my supervisor had come instead of me. Yep. Because my supervisor would have loved what the infection control procedures you have put into place, and was highly complimentary, thank you. Very highly complimentary. And so I just thought that was really neat, and a reflection of really a lot of hard work. Yeah. That's not something that just comes naturally.
Oh, it's 4 or 5 notebooks that are that thick. Yeah. I mean, it's a ton of work.
Yeah.
Ton of work. They've done a great job. I came over and met with Kat and Tony and Jolie probably about 3 weeks ago, and they were right where they needed to be. I knew they would have no trouble when DHSR came in.
Yeah.
Yep, doing a great job. And that's reflected in your numbers.
Yeah. Yeah. I think so too. I think, you know, we've been doing pretty good in regards to that. You know, and we should be expecting, because we've been told that, I'm assuming that DHSR will come back out again.
They will, yeah.
Because did they come out for every positive case?
No, they don't come out for every positive case, but they are trying to hit every single nursing community in North Carolina more than one time with just an emphasis on infection control. They have postponed some of their other survey activities so they can do this. And so we can expect, you know, more visitations, and it really won't have anything to do necessarily with numbers.
Gotcha.
If we were to have some striking outbreak, then maybe.
That would change things,
but
right? But
it wouldn't necessarily.
And they're probably just
right. So 3 of our communities have had their first infection control survey. 3 out of the 5 that will have them, and they've all done really well. They've all been deficiency free.
Good.
And so yay to everybody. We stand today at 11 positive employees across the organization.
Across the 5 communities.
Everybody ranges between 1 and 3. 3 is the highest number of any one community.
Okay.
So we're keeping it, you know, maintained. I think people ask me all the time, what do you think the difference is between having a positive employee here at one of our communities and these other places that tend to have these large outbreaks?
Right.
And there are a few things that play into that. I think one is we were very proactive about things as an organization. We did things that were hard ahead of them being required as a protective measure. That has worked. It absolutely has worked. The places that had the big outbreaks were lagging way behind us with their visitation policies.
Yeah.
And as hard as that was, our residents typically are going to be exposed through their visitors and our employees. So
Right.
that was one measure. The second measure was the wearing of masks all the time by residents and employees. That has really been key. We haven't had this here, but we have had a positive CNA in one of our healthcare centers. And so, a CNA provides very intimate, close care. And it was not transmitted, and I think it was because of appropriate PPE, especially the wearing of a mask by the employee. So it's really keeping those droplets either to yourself or away from yourself by wearing a mask.
Yeah, we've been preaching pretty hard the wearing of masks.
Right.
Out of all three, that's the one to me is like and not that there's a level of importance, but
Right.
I think wearing a mask is the number one thing.
I do too.
So
It's one that you can control.
yeah,
I mean,
and
you're in control of that.
I had somebody else tell me yesterday, which I thought was very interesting, and I hadn't thought about it, but when you're wearing a mask, you don't touch your face as much. I know I don't. When I'm wearing a mask, I don't. But when I don't wear a mask, sometimes I'm sitting here. You've probably been watching me.
You're
I'm
right.
sitting here like this, or I'm doing different
That's
things
true.
like that. And when I'm wearing a mask, for whatever reason, I guess it's just that presence. I just know I don't touch my face as much, and so I think that's really a good thing as well. So
It is, and even if, some people will say, well, when I have a mask on, I mess with my mask.
Right.
And, traditionally, healthcare workers are instructed very strictly about not touching their masks, and if they do, what they have to do. And of course, wearing a mask all the time, you're not able to follow those type of rules that you would, like if you were in a surgical field.
Right.
But even if you're just adjusting your mask or touching your mask, you still have that protection from the droplets from somebody else.
Right.
So I don't care how many times I mess with my mask or fidget with my mask on my ears, it's still by far better than not wearing one. Because of the protection from the droplets. So
That's a good point.
I'm a fidgeter, so I try not to worry too much about touching.
Sure.
And as we know from trying to get this microphone on, I have very tiny ears, which means the mask things are always slipping off my ears, and I'm always fidgeting with them, but I still wear my mask.
thank goodness for Scotch tape, because we would not have Tiffany on our show
wonderful.
today without Scotch tape today. So that's great. Tiff, another question, I think, which we started to allude to in another area here is, we're in phase 2. We've seen an increase certainly an increase in testing, but we've also seen a pretty good spike in the number of cases too. I don't think anybody really knows exactly yet if we're going to be able to move into phase 3 as fast as we would like to, but do you see a lot of changes between going from phase 2 to phase 3 as it relates to our community? Because we know what the governor's plan says, and the governor obviously has limited some of the phase 2 stuff now that is not open yet. I mean, like a big one on that is like the fitness centers,
Right.
and
Sure.
they're not open yet at this point, and they're waiting. And I know they want to be opening up. Our residents here want to use our fitness center here. So,
Yep.
but thoughts maybe on phase 3 and what might come from that?
Sure. Well, let me back up to phase 2.
Yeah, please.
A few things that we have seen in phase 2 is, as you mentioned, the percentage of positives is not declining at the rate Governor Cooper wants it to. He's wanting it now, he's saying, to be around 6, which is pretty low. And I don't think that'll keep him from us going into phase 3, but you never know what he may carve out of phase 3 like he did with phase 2 with the gyms and the bars and what the third thing was. I don't even remember now off the top of my head, but he could still, because we might not be hitting those numbers, he could still carve something out. one of the things, if you look at the ages of the people who are testing positive, the biggest increases by far are in the 25 to 49 age group.
Wow.
That's where a ton of these new positives are coming from, and especially, you know, the people in their 20s and some even in their 30s have heard, I don't need to worry about this because I'm young, and, you know, there's this perception out there that they don't have to be careful. And when I'm out, you know, like you mentioned in Lowe's or whatever,
Right.
most of the people without a mask are in that age group.
Yeah.
Most of the people that I see who aren't socially distancing are in that age group or even younger. So that could work against us because we have so many people in that demographic in North Carolina.
Yeah.
It's a huge, we know that the millennials are from a number standpoint, they're a huge demographic here. So, you know, that I worry a little bit about those numbers. We are waiting really with bated breath to find out what Governor Cooper is going to allow in the way of easing restrictions on the nursing facilities, the congregate care facilities. CMS, or Centers for Medicare Services, has issued what they think the guidance should be, but then they've told the states, you need to figure this out based on what's best for your state, how you plan to enforce it, and those type of things. So as late as the middle of last week, I was checking in with regulators at the state just to see if they had any feel for how that was going to go. And they don't have any feel yet. So, you know, he kind of waited till the last minute last time. So we have to be more careful than
The public
you know,
at large.
Yeah,
Right.
the public at large. And we have been, you know, if I look back as an organization, not just River Landing, but if PHI, our attention to COVID, which it didn't even have a name really at that point, was the last week in January is when we started monitoring this situation. That's a long time that we've been monitoring this and
Sure is.
and planning and trying to do the best we can. So we'll continue to do that. We know that COVID fatigue is real.
Yeah.
And
Yeah.
so we want to open up as much as we can, but also be extremely smart about that.
Right.
And very protective about how we do that and the strategy around that.
You know, I think one of the things that I've been hearing that's just a little disturbing is, and I've been hearing a little bit more of it, is that, you know, you went going back to the 20 to the 50-year-olds or 25 to 50-year-olds, that they feel like if they go ahead and get the virus, that then they build up antibodies and they can't get it again, and they feel like this way I've outlasted it, I might as well just get it over with, and I just, you know, I don't think they've proven yet that
They
you
have
can't
not.
get it again, even if you get it the first time. And I think that's a dangerous
It's very
philosophy
dangerous.
to have. And so I'm a little afraid of that because I have heard a little bit more of that of recent. Certainly with some sections of the population as well, that there's a feeling amongst them that that's the case. So, you know, I'm hoping that's not the case. I'm hoping that we don't have people that were, and I know our residents aren't going to do that.
Sure,
but,
sure.
It does scare me a little bit.
Yeah, it does, and you're right. They haven't proven that antibodies automatically mean that you carry some immunity to it. In theory, that's what happens normally, but this virus, even though it is a SARS-type virus, is extremely unique. I mean, extremely unique.
Yeah.
Even among the corona SARS type of viruses, you know, and so there's no way to know that yet. And I would not recommend that as a strategy.
That's not a good strategy.
And So early on, one of the first people that was a friend of mine that got COVID in Atlanta, who was in that age group,
Right.
supposedly she got it again, and she was she was early because she was in Atlanta. She got exposed to it early. She got sick early. And so when I heard that she had gotten it again, I was just crushed. I was like, oh no, this means you're not immune after you have it the first time. And quickly it was, wait. Number one, we don't know that she ever really got rid of it. You know, she was tested one time. She tested positive. But, 2 weeks later, the symptoms come back. Does that mean
Right.
she got it again, or does that mean she never got rid of it?
Yeah.
So there's so much uncertainty that, we really just have to keep in mind we don't know what we don't know in some cases.
Yeah, that's the hard part, right? There's still more questions than there are answers at this point. And so, we as a community, we as an organization, we as a country and state are still feeling our way through this thing because it's just all unprecedented.
Sure.
And, the thing that gives me promise and hope, though, is that, you think about it, we've got the entire world working on this particular virus, trying to come up with to see if the antibodies would be a good defense against it, medications that might help against it, or even hopefully someday, if it's possible, to have a vaccine for this. So, so I think the good news is we got the best people in the world working on this
Sure.
for us, and I'm hoping that's going to be a positive sign for us. So, and we keep hearing about clinical trials, and there's all kinds of tons and tons and tons of clinical trials and vaccines already
Yeah.
have been developed and everything. So I think we're just kind of all hoping that the good Lord blesses us with something like
Well, in North Carolina, UNC and Duke they're having clinical trials on some things now. So, and they
Good.
have been for at least a month now.
Wow,
So
that's awesome.
like you said, everybody's working on it.
Yeah. So I think that gives me a lot of confidence to think that eventually at some point we'll be able to have something to be able to defend against this thing. Because we know it can be devastating for the wrong person who is not who has vulnerabilities to it. It
Yep.
can be really devastating. So
It's very unpredictable.
it's very unpredictable. So the best thing we can do is, again, just remember our 3 W's. And if we're out and about, please wash your hands.
Yep.
Please wear your mask. Please try and stay 6 feet away from somebody. But
Keep alcohol sanitizer
Yep.
in your car or on your person and use it.
Yep, absolutely.
Yep. An ounce of prevention is
Prevention,
worth a pound of cure.
Pound of cure, yeah.
Yep.
My grandmother used to tell me that all
Mm-hmm.
the time. Can never remember it, but I always liked it. Well, Tiff, I can't thank you. We can't thank you enough for being
Sure,
on the
my
show.
pleasure.
It was very informative today, and now you all can see why we go to her when we
Yep.
have questions. 'Cause
She's our expert.
She is an expert. She's a wealth of information, and isn't it reassuring to know that we've got somebody like Tiffany working for our organization on our behalf of our staff and our residents here. So thank you.
You're welcome. My pleasure.
Yeah. And before we're going to let you go, I just think it'd be nice for you to share. Why don't you talk just a couple seconds about your family? I think residents always like to hear some of the
Sure.
personal side, and I happen to know your husband and your 2 kids. And tell Keith I said your wife. He'll love that, right?
My 6'4"
Yeah.
wife.
Just don't tell him here, okay? Yeah, he is a big dude. I'm telling you, Keith is a big dude. So why don't you talk about Keith?
Sure.
Kids a little bit.
Sure. So Keith and I celebrated our 27th anniversary
I was going to
this
guess
year.
28. I knew it was close to that. So.
Yeah, not too long ago. So we have 2 children, and they are both technically now grown, which is just hard to wrap my brain around, really. So my husband is a Greensboro City firefighter and has been for 30 years.
Wow, that's a long time.
It is a long time, and he reminds me regularly that he is now eligible to retire. And I just laugh and laugh when he says that. And he actually hasn't put out a fire in quite a long time. He For years, mostly ran medical calls and did paramedic work for the fire department. And now he does arson investigations, new construction. He deals with a lot of contractors and construction managers. Matter of fact, Stephen Johnson had a run-in with him before he worked with us.
Oh, that's funny. I did not know that.
Whenever I meet anybody in the construction industry, I'm always, kind of,
You never know, right?
yeah. My husband's very black and white and by the book. So our daughter is 25, and she's a graduate from UNC Chapel Hill.
Okay.
Go Heels, and she is currently in seminary at Union.
That's awesome.
And she works for Starmount Presbyterian Church, which I know some folks here are members of, and Starmount. And my son just graduated from college. He's got a degree in international business and American studies. That's it.
Wow.
We didn't think he was going to graduate because he had to study abroad. He's one of those kids that's, graduating in 2020 is a real treat.
Right.
So we didn't think he was going to be able to graduate, and then they surprised us and said he could. So he's trying to figure out what he wants to do when he grows up.
Yeah.
And he graduated from UNC Charlotte. Go Niners.
Still in that UNC system.
That's right.
Yeah.
Yep. I couldn't talk either one of them into going to app. They both got in. Neither one of them decided it was for them, but I guess they won't be able to work for PHI
That's
ever.
right.
So.
Yeah. I think that's almost
It's a
prerequisite.
requirement.
I'm not sure how I got in, though. I sneak
I'm
under
not
the
either.
radar somehow there. I don't know how that was. So. Well, thank you for sharing that.
Yeah.
And you got two great kids, and you got a wonderful husband.
I'm very
so,
lucky.
Yeah. So, okay, Lisa, we got birthdays, right?
Yes, birthday today is Betty Reed.
Ah,
so
Betty.
happy birthday,
Happy
Betty.
birthday.
And then tomorrow we have Henrietta Barrett.
Okay.
So 2 great birthdays.
All right. Do
Okay.
we have a trivia winner?
We do have a winner. Okay. let's
Sorry,
see.
Francis, you don't get the shirt.
No, he doesn't. The prize today is the polo shirt, so that's exciting. And the question was, when Cameron Morrison was inaugurated governor of North Carolina in 1921, who performed the traditional duties of the First Lady since he was a widower? The answer is his 8-year-old daughter, Angelia, since her mother had died 2 years earlier.
Wow.
So,
How about that?
That's pretty cool.
Yeah.
That is cool.
I like
but
that.
never would have known that one.
Yeah.
And the winner today is Lou Witt. So
Ah,
congratulations.
very good.
Yeah,
That's good.
Very good.
That's good. So you get your choice of shirts.
That's right.
Medium, large,
Medium,
or...
large, or extra large. And they're all the blue color.
Yes.
So,
Well, that's awesome. That was a
yeah.
good question. That
yeah,
was...
that was.
Thank you, Francis. Okay, so let's see. For the rest of the week, we've got the honeymooners,
tomorrow.
We got Ken on Wednesday. And then Thursday and Friday we're going to have homework coming one of those
One of
2
the
days.
days,
Probably
yes.
Friday, right, is what we decided. So we'll have to come up with something for Thursday,
Right,
I think.
right.
So, okay. Sounds like a great week coming up. And so Tiffany, you don't know this, but we always end with a little story or joke or whatever. And so usually when Ken, our chaplain's on, he'll tell a little joke at the end, and then because it's usually so bad, I've got to do another
Do it
one
again.
afterwards to kind of...
Worse than yours, huh?
Yeah, thanks a lot. Thanks a lot, Tiffany.
Okay, go ahead with yours.
Yeah.
Knows you well.
I think you'll like this one. So, it says a policeman was placing a parking ticket on a car when an elderly couple walking out of a restaurant spotted him and immediately walked up to him to complain. The cop refused to listen to him, so the man took the ticket off the windshield and ripped it up and threw it on the ground at the policeman's feet. "How dare you," said the man to the cop, whereupon the policeman took out his book and wrote up 2 more tickets to place on the car. The furious man told the cop that he should be considerate of older people and tore them up again. This time, the policeman called up the towing company to have the car towed. A bystander was watching this, and as the car was being towed, he walked up to the couple to offer his condolences. They thanked him, And as they walked away, they too felt deep sorrow for the owner of the car.
That's a good one.
I thought that was really good, right?
Good.
Yeah, that's cute. That's cute. Good way to end our Monday.
Yes, absolutely.
So, okay. Lisa, anything else?
I don't think so.
I don't think
That
so.
was it.
Good Monday show.
Yes,
For those that could see it, right? And,
that's
Yeah.
right.
You know,
And
for
if you
those that
see
can't, make
it,
sure you call in and let us know,
Yeah.
right?
don't know that you didn't.
Yeah.
Oh, no, that's
and
right.
Raise your hand if you didn't see the show.
hopefully you have a friend that will call you.
Yes.
I don't know.
That was cute, Lisa. I like that.
Maybe they'll see it on
Didn't really
YouTube,
think through that one.
right? Maybe they'll watch because it goes on YouTube,
It does
right?
go on YouTube,
So then they'll see it, and then they'll call in
but they
and
don't
say,
know
"But I couldn't
that
see
to
it."
go look at YouTube.
Well, maybe if they missed it, they'll know
They
to go.
might. They might.
Because it's so pressing, they must go see it.
That's
even
true.
if they have to go to YouTube.
And it is up to date. YouTube is up to date.
Wow.
It is up to date.
Yeah.
Michelle's doing a
Fantastic.
great job keeping up.
So that's where I'd go.
Yeah.
And I
sounds
think-
good.
But
Tiffany, before we go, I think you were a little worried that we were going to, you know, because our past has been whenever we've had anybody from the Management Services Office on the show,
nobody else
we've
will
done
come back.
something to them.
So you
Nope.
roasted them.
Marisa had the 10 reasons to be married to a police officer, and we had, what was the person that came out, I've forgotten his name now, that came out and interviewed Tim. What his stage name was, of course. I
I
know
can't
who the
remember.
resident is, but
No.
anyway,
He was an inspector.
it was
so,
hysterical. Tim Weber, that's what he was looking for, Tim Weber. So yeah, that was pretty.
I
fun.
had an idea for you, but we didn't have enough time.
What were you going to do?
Thank goodness.
The top 10 reasons to be married to a firefighter.
Oh, there's, yeah,
There would
lots
have
of
been
those.
some good ones.
There would have been. And I probably, well, anyway, I'm glad you
She
didn't
would
do
have
that.
contributed 8 of the 10 without even having to
Yeah.
blink an eye, I'm
I'm glad
Yep.
you decided not
So
to.
we decided.
sure. Or
not
maybe
to.
the better thing was 10 reasons not to be married to a
You know, they always say you can change a negative into a positive.
There
if
you go.
Think,
Yeah.
That's the way.
if you think about it. Put some time into it.
Well, there you go. So
Absolutely.
we'll take that positive and we'll end the show. We hope you have a great Monday evening. Love you all. Have a great evening.